Okay. So to start off, I would like to invite Dr. Hem Kumar, TR, consultant physician and diabetologist at Kaveri Hospital, Bengaluru, EC member KRSSDI. We welcome you, Doctor.
Thank you. Thanks for the kind welcome and the introduction. Good morning, everyone. Yesterday was quite exhausting and tummy feeling also later in the day. So how are you going to burn it out? We have three experts here to tell us how to walk the talk, walk, swim, play, cycle, whatever it is. So how are we going to keep ourselves healthy, fit? So we have three experts. So I would invite Dr. Balaji Jaganmohan, consultant physician and diabetologist at Apollo Sugar Clinic, Bengaluru. And he is one of the fittest RSSDA member. Welcome, Balaji. And I would like to invite Dr. Basavaraj Patil, professor and HOD, Department of Medicine at Raichur Institute of Medical Science and Basav Hospital, Raichur. He is immediate past chairman of KRSSDI. Anybody who is in the RSSDI group should wake up to his messages about cycling hundreds of kilometers. Welcome, sir. And with that, I would like to welcome Dr. Utkal Kishore Khadanga, consultant physician and diabetologist at Utkal Diabetes Specialty Center, Bhubaneswar, Odisha. He is probably an Ironman. He has done so many runs. So welcome, Dr. Utkal. And I'll hand over to the session.
Good morning. Thank you for introduction. I'm Dr. Basavaraj Patil, professor and head of the Department of General Medicine, plus in charge principal for the Government Medical College. Plus, I'm running a 50-bedded hospital. Plus, I'm the director for Raichur Diagnostic Center for last 10 years, and also other societies means Lions Club, IMA, plus our APA Karnataka chapter, building committee member, past KRSSDI president of our Karnataka chapter. Why I am telling is, because of these are the busy schedule with all the, as a principal looking after 21 departments plus HOD and teach to the PGs, UGs, and also running hospital with the family also. I am now 56 years age. When I started the first diabetes 15 years back, I started my prescription was the wellness of journey. See, I started my cycling in 2014. This was my cycling journey. Whatever I did for last 10 years, I am presenting here. Then the prescribed pedal was the doctor's cycling wellness journey. Clinical physiology was longevity and consistency. We are doing the consistency in our day-to-day. The fitness journey was started cycling during 2014 when I was diagnosed pre-diabetic. Managing duty work, weeks and chronic clinical stress need a high yield, time efficient escape. The prescription cycling becomes more than exercise. It was my medical prescription for personal reliance and long-term professional sustainability. See this, what are the challenges was I did? The long duty hours, traditional routine fails against hospital schedules, irregular sleeping, shifting work disrupt metabolic and hormonal balance, then sedentary lifestyle, high stress environment combined with limited movement. The goal was the systemic improvement of physical and mental biomarkers. This was This is in the Munnar. When I went for the Munnar, this was the picture. Then what are the transmission milestone? My heart rate was, the resting heart rate was 82 when before starting my cycling. Now my resting heart will be 62. Improved the recovery times, high aerobic capacity and injury-free training. The next, the silence behind the cycling. Then what are the effects on the body? Cardiovascular system, strengthen the heart muscles, lowers the blood pressure and optimize the lipid profile, plus to maintain the mental health also. Then metabolic, increases the insulin sensitivity and enhances the mitochondrial efficiency for energy production. Then mental health, this triggers the neurochemical release like endorphin to combat the chronic burned out and stress. The next, the clinical and longevity outcome, the condition and clinical benefit and mechanism, diabetes, CV, mortality, cancer risk and overall life. In the clinical benefit, it reduces the risk and glycemic control, the significant reduction for the CV, cerebrovascular accident as well as cardiovascular activity, then myocardial strengthening, then metabolic inflammation reduction and also preventive cellular aging. Joint friendly fitness, biomechanical versus punishment. Unlike running, cycling offers low impact loading on the knees and ankle. It allows for high intensity training without the typical musculoskeletal wear and tear of the weight bearing cardiovascular system. My secret was discipline over the motivation, medical appointment status, treat exercise as a non-negotiable professional booking. Early morning strength right before the clinical day interferes with the personal time, track progress, quantitative metric beat emotional assessment, routine, this dominance consistency beats intensity in the long term clinical view. This is my prescription. Every week I am going for at least 25 kilometers every third day or second day. In the Sunday, I am going for 50 kilometers non-stop. And also, in the 3-day protocol, I am doing 50 minutes per session. As a 5-day protocol, 30 minutes my cycling, and also total target 150 minutes in a week. This was the health mantra, movement of medicine. Then started when you are, and day consistency, prescribe moments in my this thing. These are my group activities, cycle ride, ninda, deha, mattu manasika nemmadi. So many I did participated in the activity at least all the day. It means World Diabetes Day and World Heart Day, World Hypertensive Day, HIV Day, Tuberculosis Day, all the year I am giving in our place, Raichur, I am doing cycling along with my friends. See, I started in 2014 and myself, my friend, only two are there in our Raichur. My colleague is Dr. Jay Prakash. He is a gynecologist. We started first cycling in Raichur. Then now we made the big Raichur Cycling Association. We have now 40 members. 40 members. For the by seeing us, they got motivated. They came for the cycling. See, these are the major cycling I did. Raichur to Srisela means almost 350 kilometers in 2 days. I went in one day 230 kilometers. This was my highest, 230 to 240 kilometers in almost 16 hours. Then I went for almost 2 times. Then I went for Leh Ladakh, from Srinagar to Leh Ladakh for 5 days. I took almost 5 days to reach the Leh Ladakh. Then Raichur to Tirupati, almost 450 kilometers in 2.5 days. I went along with my friends, and almost 2 times I went to Munnar trip. Almost every day 70 to 80 kilometers in and around the Munnar, and also cycling in Goa, Sasti ride. Almost in 6 hours I did 100 kilometers in and around the Goa. And I went almost 3 times from Raichur to Hampi. Almost it is a 130 to 140 kilometers I did in almost in 8 to 10 hours. This is my prescription for cycling. See, do the cycling, you are in the morning, then your day-to-day activity increases. This is my prescription for cycling. Kindly do some yoga or exercise. I am doing cycling. My colleague will talk on regarding on yoga. Thank you for giving opportunity, and also thank you for our Disha and also Dr. Manohar giving this podium. Thank you. This is my video start ಆಗ್ತದೆ. This is my. I got 5 cycles. All are with the gears. I took first one was the specialized cycle, second is the Cannondale, third one is the between, and fourth one is BMW cycle is there, and also one normal cycle. All the cycles are wonderful. These are the not a cycle, these are the bikes. We called it as a bike, and almost all the bikes are I took from the Bangalore. This was my small video. Going for this is the in my Raichur. Thank you for watching. Thank you.